good. So we're going to pull it back together here. So one of the questions I just got is, do I get a list, or how can I get all the techniques? And actually, you've got a white piece of paper that's the single sheet of paper there that actually has all the techniques on it, so that you have it. We just kind of made it a different color so that you wouldn't focus on it here. But, you guys did a really good job with this. So just to recap, we've talked about 4 different techniques, but we used a jigsaw technique, so a 5th technique that you can use to engage your learners. And so just to recap the jigsaw here, we formed kind of the sharing group that you started out in and then you ended up in. And each member of the group became an expert in one part of things. Now, if I were doing something where I was going to see you guys tomorrow, I could have assigned you this kind of as your homework tonight, is to learn about your technique, or could have asked you to look it up. We did it in a way that we gave you the information to learn, but there are a lot of ways that you could do that. When you had learned a little about your technique, then we had you form an expert group, so you could really discuss the application of it and really figure out how it could be used and really feel more confident that you knew your technique. And then finally, we had you come back and share your new expertise with everyone else in the group. So someone who had the pause procedures, care to tell us a little bit about that? Perfect. They want us to use this because they're recording. So I'm going to fake like we're doing.
So we looked at the pause procedure, and so applying that to a peds respiratory case, we could say, go through your case, and then what are your differentials here? Have everyone write that down. What's your algorithm here? Have everyone write that down and kind of go over it. And then the second part of that is the muddiest point. So during your case, you can pause and say, what do you think is most confusing, or what did you have the most trouble with, to kind of bring it all back together.
Great, and that the muddiest point is then a great way to, really make sure that your learners have understood what you thought you were teaching them. How about roundtable discussion? We'll come to this table. Who had that one?
So the roundtable technique is going to be a technique in where you have your group of learners at a table, and you'll pass around a sheet and have each person contribute something to that sheet pertaining to your topic at hand. So, for example, in our discussion of pediatric respiratory distress, that could be, for example, a differential diagnosis or critical actions. The topic should ideally be something that are going to be short, a long list of potential contributions, preferably, and then once the sheet has made its way around the group once or twice, then you'll have a reporter that can summarize with a set of conditions, for example, no repeat answers, or give me the can't miss diagnosis off of your list, or the most likely diagnosis.
Perfect, great. Next, thinking hats. Who wants to talk about that? Oh, I know, it's my two fellows, so, and Dorothy is closer, so.
All right, so technique 3 is thinking hats, and it's a way to critically look at the problem and get your learners to essentially wear different hats or have a different viewpoint. That's the way to approach it. You could have each, in this case with respiratory distress, the learners could be a different team member that's involved in helping the child with respiratory distress, so like the RT, nurse, patient, parent, where they look at different factors that will lead to an improvement, so improved outcome. So looking at the equipment involved, or the environment, teamwork and communication. And you could have all the learners wear the same hats, or each one wear a different hat to add on to the different viewpoint.
Perfect, yeah, and like I had mentioned to them, one of the ways I like to use this is to really think about, what do different people on a team need to know? So, for example, we think about parents and what do they need to recognize about respiratory distress, and really taking their viewpoint. What does the triage nurse need to know? What does the intern need to know? And then what does, the senior resident or fellow need to know? And thinking about it from all those different perspectives. So perfect. And then finally, Fishbowl.
So in Fishbowl, you have a small group of learners, maybe the med students or the interns, if you want to break them out by level, if you are trying to figure out how to teach to all the different levels. Have maybe, the least experienced group start first. You pose a question. The people in the small group are able to have a discussion, and everyone else in the room kind of listens, watches the discussion. Once they feel like they're at the limit of their knowledge, then you could either switch the fishbowl where they come out and the next level goes in, or everyone else in the room can add in their thoughts.
Great, perfect. And then another technique that we are using and that we're going to use a little bit later to inform our panel discussion is entry-exit tickets. So we're giving you a bunch of different techniques, and you'll see that they're all very similar, they're all very fluid, and so the nice thing is you can adapt any of these to whatever you're teaching. Entry and exit tickets are a really fun way to either have people ask a question who might not otherwise ask a question, or who have an area that's confusing, so you could use it as the muddiest point. So they come in and start the day by writing down what their muddiest point is, and then you try to address that. Or you have them when they're leave an exit ticket with a question or what their goal for the next session would be or something like that. So it's a good way to get information from your learners. So our hope is that you'll take something that you've heard here and apply it the next time you have a teaching session. We've tried a bunch of different techniques. We've talked about a bunch of different techniques. And so kind of the final thing I want to have you guys do is on the last page of your handout, there's an area where I'd like you to make a commitment here. So I'm going to make you do a commitment exercise in kind of a short 1-minute paper and just write down what technique or techniques you've seen here today that you'd really like to try and how you might use that when you teach next. So just take just a minute to do that. Yes?
While people are thinking and writing, these are really cool and a lot of great techniques, and probably relatively straightforward to implement in a group of medical students that haven't developed any bad habits yet, right? Or not too many bad habits. But when you have residents that haven't experienced some of this before, and this is all new, and they're feeling rushed and they're feeling constrained, what techniques have you used to try to kind of get kind of more seasoned residents to buy into some of these novel techniques?
So I think that you can use, it depends on the setting obviously, but I think you can use these techniques right off the bat. A lot of them are just adaptions of what you naturally do. So for example, the roundtable is kind of like going around and asking for differentials from people. And so just, saying that we're going to do this in a different format. Today we're going to sit at a table or, stand in a line at the counter in the emergency department and pass the paper down. And, I want you to write down, your differential or your top choice of what might be causing this person's symptoms. So I think, just playing with it, I think once people get involved, I find that there's good buy-in from people, so I don't find a lot of resistance. I think the most resistance comes from people who are from different generations, so my generation or higher, who were trained in a very different manner. On the flip side, I find that those are some of the people who are the most excited about learning these techniques as well.